Now let's contrast this with a knee that has osteoarthritis. So you can see it looks extremely different from a normal healthy knee. You've got the meniscus that is getting worn away. You see bone spurs, calcium deposits. The cartilage is torn. We don't have a photo of the synovial fluid, but the synovial fluid gets worn away. It can also get calcium deposits. So definitely does not look as nice as the normal knee. Let's look at rheumatoid arthritis. So once again, you're going to see that the synovial membrane is inflamed. So that's what contributes to the pain. You are going to see a wearing away of the cartilage. The cartilage is pitted. So the wearing of the cartilage, we might hear people say, oh, I had, bone on bone, and that's because they've worn their cartilage away. So you can see where this can cause a lot of pain with the inflammation of the synovial fluid and the wearing away of the cartilage. So again, what are the common medications of arthritis? A lot of people take over-the-counter medications, so you probably recognize a lot of these brand names. So they do work pretty well. Tylenol, aspirin, the NSAIDs, non-steroidal anti-inflammatories. So Motrin and Advil are ibuprofen. Aproxin is Aleve. That's the little blue one. Some people do have to take prednisone. We've talked about prednisone a lot this semester. There are different drugs. So interesting that methotrexate, we also talked about that as a chemotherapy drug for cancer, if you remember that. So that is a very powerful drug. It is effective, but it also is used for rheumatoid arthritis. TNF alpha, tumor necrosis factor blockers, Enbrel, Humira, you probably have seen commercials for those. So those are anti-inflammatories. TNF is a cytokine which produces inflammation. And then Batacept or Orencia, that affects T cells, once again part of the inflammatory process. Symptoms of osteoarthritis. Most people are not going to have symptoms in the early stages. And, it is a lifetime process just like anything else. Tenderness, crepitation, which is also known as crunchy. If you touch the joint, you hear a crunchy sound. The joints can look larger because of swelling. Morning stiffness, is this something that just happens with normal aging? Reduced range of motion. This is one of the reasons why people really need to focus on flexibility. And increased body sway with decreased balance, especially if you look at older women who maybe have some hip injuries, osteoarthritis of the hip. They kind of waddle when they walk. So that's an indicator of people who have arthritis in the hips. So what happens? Pathophysiology, why do people get osteoarthritis? As we mentioned, it's like many of the other diseases we've studied this semester, increasing age, 50 plus. Women do tend to have it more than men. There are genetic factors. So if you have a family history of arthritis and your parents have arthritis in the spine or the knees or the hip, there's a good chance you may have it too. Interestingly, about bone density, if your bone density is high, it's going to increase your risk of osteoarthritis. But if you're losing bone, so if someone is losing bone mass, they've got osteoporosis or osteopenia, they're going to increase their risk as well. Overweight and obesity put a lot of stress on the joints, so that goes without saying. And something that's especially important for athletes, that previous sport participation, say for example, particularly women who've had ACL injuries, they are at risk of early onset arthritis in that knee joint. So that is something to keep in mind. Again, more so with women than for men. And of course, people who've had occupational injuries, so repetitive motion injuries, that also increases their risk of osteoarthritis.